Hey everyone, my name is Kobe James, and today I'll be presenting my micro teach on VRE. This presentation will cover what VRE is, how it develops, how it's diagnosed, what it means for both medical and rehab care. So VRE stands for vancomycin-resistant enterococci. So enterococci are bacteria that normally live in the human intestines and sometimes the female genital tract. They typically don't cause problems unless they move to a different part of the body. The issue arises when certain strains acquire resistant genes, specifically VAN A and VAN B genes, which change the structure of the bacterial cell wall. This prevents vancomycin, which is usually a last-line antibiotic, from binding effectively. Because of this resistance, infections caused by VRE are much harder to treat and often require stronger or less commonly used antibiotics. VRE can also cause UTI infections, bloodstream infections, and even endocarditis. What makes VRE especially dangerous is its ability to persist on surfaces for long periods of time and spread easily through direct contact or contaminated equipment. So diagnosing VRE usually begins with collecting cultures from the suspected site of infection. So, for example, blood for bacteria, urine for suspected UTIs, or wound swabs of an incision or pressure injury if it's infected. Once the culture grows in the lab, antimicrobial susceptibility testing is performed to determine which antibiotics the organism is resistant to. The focus is on detecting VAN A and VAN B resistance genes. Many hospitals use PCR testing. PCR testing detects the genetic material of resistant strands and can give results within hours instead of days. And rapid diagnosing is extremely important not only for selecting the right antibiotic, but also for infection control. If a patient is positive for VRE, they must immediately be placed on contact precautions. VRE is most commonly found in hospitalized adults over the age of 65. Older adults tend to have weaker immune systems, more exposure to antibiotics, and more frequent hospitalizations. And other high-risk groups include immunocompromised individuals such as cancer patients undergoing chemotherapy, people with chronic kidney disease, and patients in the ICU. Children can also get VRE, but it's usually seen in those with congenital immune deficiencies or those requiring long-term antibiotics. The prognosis for VRE varies depending on a few key factors: the patient's immune status, the site of infection, their overall health, and how quickly effective treatment is started. VRE bloodstream infections have the poorest outcomes because bacteria significantly increases the risk of sepsis and organ failure. Patients who are immunocompromised or who have multiple comorbidities are also at higher risk for complications. So early diagnosis and timely antibiotic therapy can improve outcomes, but many patients still require extended hospital stays. Since VRE is resistant to vancomycin, other antibiotic options must be used. The two most common medications are linalazide, daptomycin, and linalazide and daptomycin. Both are strong antibiotics that require careful monitoring because they can cause side effects such as low blood cell counts, muscle pain, and GI issues. Other medications such as triglyceride or combination antibiotic therapy may be used in more complicated cases. But infections control measures are essential with VRE patients. Patients with VRE often experience a combination of impairments that depend on where the infection is located. Common symptoms include fever, pain, inflammation, inflammation, or delayed wound healing. However, many of the functional issues we see are secondary to other things. Patients with VRE spend more time in bed and have fewer opportunities for mobility and often receive less frequently, especially if they're in airborne or contact isolation. This leads to like muscle weakness, decreased endurance, impaired gait, and reduced activity tolerance as well. Patients may also experience psychological effects such as anxiety or social withdrawal because isolation limits interaction with others. In therapy, our goals include preventing further deconditioning, improving overall strength, and endurance, and restoring functional mobility. Interventions may include bed mobility, transfer training, gait training, with or without assistive devices, balance exercises, and strengthening programs tailored to the patient's type. Because VRE patients are isolated, PTAs must be strategic with scheduling as well. Many facilities prefer treating isolation patients toward the end of the day, which can reduce the risk of cross-contamination, and frequent equipment disinfection are required between each of these patients. VRE requires contact precautions as well, as far as wearing gloves, gowns, hand hygiene. Private rooms are recommended for these patients, and equipment used for therapy should be either single patient use or disinfected thoroughly before beginning use with another patient. And it's also great to always monitor the patient's fatigue levels because some medications used for VRE can affect their muscle functioning, which causes fatigue in their muscles as well. So impacts on PT plans and goals. So isolation may require modifying the frequency and intensity of therapy. Some patients may only tolerate short sessions or need more frequent rest breaks. Goals should be functional and realistic. So, for example, improving mobility for transfers, walking household distances, maintaining balance, or increasing endurance. Because isolation reduces patients' interaction with their environment and can limit therapy opportunities, education becomes even more important. Teaching energy conservation strategies, safe mobility techniques, and infection control measures helps patients to continue progressing outside of therapy sessions. In closing, VRE is a serious multi-drug resistant organism that poses challenges not only for medical management but also rehabilitation. PTAs play an essential role in helping patients recover strength, mobility, independence while also preventing the spread of the infection. By combining evidence-based interventions with strict precautionary measures, we support both patients' recovery and the safety of the entire healthcare environment. Understanding the pathology behind VRE, the impairments it causes, and the required precautions helps us provide safe, effective, and patient-centered care. Thank you.